of the country by aligning them to the universal health coverage. A new curriculum for medical professionals is being proposed to keep up with the dynamic changes in the medical field. Our health and science reporter, Beldin Waliaula, with more.
Monday's universal health coverage launch that will be graced by President Uhuru Kenyatta, the Kenya Medical Practitioners and Dentists Council KMPDC, together with the Ministry of Health, will be launching the harmonization of health curriculum that will be used to train health officials.
We are planning a very important conference which is going to look at the training of health professionals post-COVID. During the COVID period, we experienced a lot of challenges.
The new curriculum launch is also to look at principles of incorporating telemedicine as a new form of offering medical care services in the country, especially now that COVID-19 has necessitated the use of technology in almost every sector.
The issue of seeing a patient using telemedicine electronically has various challenges. And one of the challenges we want to address, we are going to consider who to blame in case of a misdiagnosis. Who takes the responsibility? Is it the equipment that is going to be used while assessing the patient? Is it the practitioner who is seeing the patient electronically at that time? Or is it the practitioner who is going to dispense the medication that will be used for that patient?
And I think the pandemic has really revolutionized, given us an opportunity to revolutionize not only training, but more importantly, access to care for our citizens. And we need to ensure that as we go into team-based care, the public is not left wanting about who to trust and who does what. So hopefully, in this conference where all the professions come together, we will come up with a mechanism of how we cooperate with each other so that the public is protected. Access to care is guaranteed.
The revamping of the medical curriculum is set to address needs that have been brought about by COVID-19, where ICT and English programs have been cited to be crucial when upgrading medical worker skills to meet the growing demand for health services. The harmonized curriculum for training medical professionals will also ensure there is adequate human resource in keeping up with the UHC that will be rolled out across the country on Monday. Beldin Waliaula, KTN News.
Okay, now a lot of developments happening in the health sector, and equally we're keeping our camera lenses trained in Mombasa, where the president a little bit later on is set to roll out the scale-up of the universal healthcare coverage. And it's proper to note that the government of Kenya is committed